The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
So welcome everyone to this webinar on vacuum erection devices. And during this, I'm going to explain a little bit about, we'll touch on erectile dysfunction and the reasons why we offer vacuum erection devices, or you'll hear me use the term VED or a pump. So vacuum erection devices tires me out just saying that once. So I have to say that multiple times, so I think we'll never get to the end. So if I say VED or a pump, please understand that I'm all talking about all the same thing. So I think we're going to start with a little background information on just the overall process of how we achieve an erection as a man. So when aroused, and again, that may be physical or mental, and certainly a combination of both is helpful. The nerves near the penis, mainly the ones we're talking about that innervate the blood vessels to the penis, are activated. And when the nerves are activated, that stimulates the arteries to the penis to dilate and open up and release blood to fill the channels in the body of the penis. And as the blood flows in, and it's generally flowing in at a rapid rate, it cuts off the veins that drain the blood out of the penis, which is a low pressure system. The arteries are a high pressure system. And that allows the penis to become erect or hard and stay erect. And one of the things that not mentioned here that we hear a lot in the media, in the literature now, is nitric oxide. And we know about that because of Viagra and Cialis and those kind of medications. So nitric oxide is actually what comes out of the nerve that then causes the artery to dilate. And these medications that we use for erections, when they work, will block the enzyme that breaks down nitric oxide. So that means more of it will stay around longer and have more of a stimulating effect on the artery, helping to continue and increase the blood flow into the penis. So I think this kind of enables us to really have a basis of the understanding of an erection and just kind of how things work to better understand how the pump works. So this is a vacuum erection device, and I'll actually be showing you this particular brand of device here at the end of our talk, and you can see some of the items. So let's go into details of sort of what makes up the VED. And I guess a little background information first. These devices have been around since the early 80s. Again, we said everything there are all the synonyms I'll use, including vacuum therapy system. Boy, that's a mouthful. And how does it work? So it's basically a hollow tube that will use to form a seal at the skin around the base of the penis. And it attaches to some form of a pump. You can see on the Owen Mumford pump there on the left, the manual pump and so on, and the electric version of another type pump from Augusta Medical that is battery powered for patients that don't quite have maybe the manual dexterity or the strength to use the manual pump. And with each of them, you'll see some different devices, and I'll explain each of those. And basically, it's a vacuum. It's literally just that is drawing out, literally pulling from inside out the penis to bring vacuum with a vacuum effect to bring blood into the penis, irrespective of whether the arteries have been stimulated to dilate. We're actually kind of sucking the blood out of the arteries into the channels in the penis, the cavernosa as they're called, which are sort of a mesh-like cylinder that fill with the blood to make the penis erect. See if I hit anything. We'll talk about the constriction rings that can be used with that. We'll talk about penile rehabilitation or reconditioning that we might use the pump. And basically, these pumps should be, it says sort of 90% effective. I'll say close to 100% effective. Really, there's no reason why that vacuum effect, as long as you get a seal, should not work. So let's go on to some specifics about the pump. So anyway, the pumps are not completely. Usually there's the general size, sort of almost a one size fits most, but certainly there are adjustments that can be done, and we'll look at more deeply with the pump for different size men, different body shapes, and so on. I already talked about manual versus battery as just options in terms of the hand and the hand strength. Not that it takes a lot of strength to use these. And just some of the components that can be changed, different sizing adapters that can attach to the bottom, tension rings, whether you add lubricant or not to help get a better seal. Sort of like the example here, different size, different adjustments to even a brace that the orthopedist might use. So we talked about the different components briefly about the VED, so let's look at it in specific. So the numbers on the left in the list are referring to the numbers in the circles on the right. And when I show you the device on the video live, I'll show you how the pieces come apart and so on, but typically that pump head can be removed and certainly make it easy for storage. That's where the actual physical pump is, in this case manual. And then we have the cylinder, the penile tube, where the penis at the other end from the pump is going to be inserted. And if desired, you can use, in this case, they refer to them as transfer seals or end sleeves that can add to the plastic tube. It can add a rubber element, which sometimes helps to get a better seal at the base for the erection, to just get a better vacuum, tighter fit. And certainly some of these can be tapered. Some of the sleeves are tapered down, and there's even additional items that you can buy generically for multi-use on multiple different brands of pumps and so on. Certainly the pumps come anywhere, I tell patients, from probably $19.99 or $29.99. You can find on Amazon or Adam and Eve or at an adult store, to upwards of $700, I think, at one of the adult stores near me that I've been into, sort of talking urology with them. And I think any of these can work. I certainly think I like to go with the medical brands, and you'll find some of those medical brands in some of these adult stores. But I think there's something that'll work for everyone's pocket, and for the most part, they should all work. They may not last, but they should all work. So at number 3 there with that transfer sleeve, you can, if desired, put a little lubricant at the base to get more of a wet seal, which sometimes helps make a better vacuum. Certainly the patients we're recommending should trim or shave the pubic hair, so the lube or the connection gets a better pump to skin direct contact without a lot of hair getting in the way, which may not allow for a good seal. And certainly you also put a little lubricant on usually the head of the penis, so as the penis is growing and enlarging in the cylinder, it is easy to slide along the inside of that plastic tube and not get cut, and sort of call what I kind of refer to my patients as almost a rug burn, getting stuck on the plastic is not comfortable. This kit comes with a ring sizing guide and so on for the different sized rings. And then on the left, I skipped number 5 there. Most pumps come with a sort of a loading cylinder that goes on the end of the pump tube to allow you to slide the constriction ring up to the base of the plastic tube or one of the other sleeve transfer devices, so that once the penis is brought erect with the pump, if it's going to be used as the only means for sexual intercourse and to keep the penis erect, then we need to put a constriction ring on, because as soon as you release the vacuum, and all these pumps do have a release valve to easily release the vacuum, but as soon as you do and the vacuum is lost, if that is the only means of blood being brought into the penis, then the blood is just going to flow right back out and not maintain an erect penis. So the constriction rings, of course, come in different sizes, different size people, different size rings, and not just for different size penises, but certainly some men have more of a dysfunction than others, and so some men can have some of their own function in combination with the pump action, and might need less of a narrower or tighter ring, and some men might be fine with a larger ring. So certainly different sizes for each. So I think not just learning how to manually or physically use the pump, because it's not that difficult to use, and I usually go over it together with the patient and myself, together with a demonstration pump, to really kind of show them. Most of the time we don't need to actually bring the pants down and put the pump in, unless really they're having trouble coming back to use it. But there's a little bit of a learning curve. You don't want to use the pump sitting down. The skin's going to kind of get folded up. You're either going to be standing up, maybe even leaning against the wall or a counter in the bathroom, or laying down. That way everything is sort of straightened out, because, and some of the reasons why they have these different size sleeves or attachments that go at the penis end of the pump, is because sometimes, depending on the size of the penis or just anyone's anatomy, sometimes the skin from the scrotum, even a testicle, could sort of be vacuumed into the pump, and you can imagine not comfortable. So these devices that go at the end of the vacuum tube kind of block them from coming in. Some of them almost are even like a dental dam, that the penis kind of goes through this and creates kind of a rubber seal around the rest of the end of the pump to prevent anything else from coming in. And sometimes can even help get a better vacuum seal. I think certainly, I always tell my patients with any sort of sexual health, it takes two to tango. So I think it's great to have your partner come in with you to the meeting with your urologist and really see, because I think sometimes if some people are embarrassed or just don't know what their partner's going to think, and they maybe pull out this pump and the partner says, "What on earth is that?" And then it may become into an uncomfortable discussion in the bedroom when that could have been addressed ahead of time. Maybe it gets treated like a sexual toy in the bedroom and just kind of a part of the whole foreplay and sexual process, instead of something more medical and mechanical and so on, that everyone needs a little help in different ways with all kinds of stuff we do, and this is just part of the process of getting there. So I think each of the patient and the partner need to be willing to adapt and work together, and not really create a wall, or one partner goes to hide in the bathroom who's using the pump and comes out with a constriction ring hidden, not wanting anyone to see. And I think that communication and those communication skills between the partners is very important to sort of getting the pump to work, but really getting the pump to work in the whole process of sexuality and sexual function. So just reading through, I think, preparing ahead of time, reading the instructions, not being one of those people who want to just figure it out on the fly. And certainly if you're doing that in the bedroom the first time, that can be a source of a lot of frustration and aggravation for both people. The pump that we'll look at today does come with a CD with instructions on it. There's a lot of different videos online, many of them cartoonish, but certainly some live ones where you can see someone using a pump. YouTube's got a ton of stuff to look at. And let's see, I think just giving things a chance before you get frustrated using the pump, and you'll find that it's actually pretty simple to use, pretty quick to use, and it's just going to take, excuse me, some trial and error to really learn, if you're using this for sexual intercourse, to really learn which size constriction it is, how much of the pump you need. This is not a no pain, no gain situation. We're not looking to have you bring the penis to the point of explosion. And to answer some of those questions, the pumps are set up with maximum pressure. You cannot make your penis explode. I'm sure people were worried about that, but make it to the point of a little discomfort, but even to the point of sometimes people have gotten a little black and blue. So it's better to sort of learn progress as you go and understand what works and what works for you.
Before you start, familiarize yourself with the contents provided in your Rapport Classic Vacuum Therapy device system. You will find the constriction ring sizing guide at the back of your instruction for use booklet. To use your Rapport Classic device, you will first need to determine the correct constriction ring size. You have received 5 constriction rings with your Rapport Classic device. Select a slot which fits firmly around the base of your flaccid, non-erect penis. Try the largest size first. Each slot has a ring size marked above it, which corresponds to the ring you require. The constriction ring is placed at the base of your penis next to your body, and choosing the correct ring size is important to maintain the erection for the necessary period. Once you have selected the right ring size, you're ready to begin. There are 2 transfer sleeves provided with your Rapport Classic system. Depending on the size of your penis, you should choose which of the 2 is likely to be the most suitable. Remember, your erect penis will need to be withdrawn through the transfer sleeve. One of the transfer sleeves included with your Rapport Classic system is already attached to the penile tube. If this is the correct size transfer sleeve for you, you can leave it in place. If not, remove it and fit the remaining transfer sleeve. Fit the loading cone onto the transfer sleeve and apply a little lubricating jelly, included with your system, on top of the cone. Holding the constriction ring by the outer handles, simply stretch and pull the ring down the loading cone until it slips onto the transfer sleeve. Make sure the constriction ring is located on the flat groove at the center of the transfer sleeve. The constriction ring is now mounted and ready for use. Before continuing, make sure you use the lubricating jelly to lubricate the end of the transfer sleeve. Also, lightly lubricate the penis to prevent it from sticking to the inside of the penile tube during insertion, or while using the pump. The pump head has 2 small pegs on each side above the orange ring. These should be positioned into the 2 grooves on top of the penile tube. The 2 parts are then locked together with a twist, so that the 2 pegs slot down and locate at the lower end of the groove. If these 2 parts are locked together correctly, it will ensure the unit is sealed tight enough to create a vacuum inside the penile tube. To ensure a vacuum will be created, insert only your penis into the penile tube and apply slight pressure to the seal, with the transfer sleeve against your body at the base of the penis. To ensure that a vacuum is created, it may be necessary to groom the hair at the base of the penis. Make sure the constriction ring on the transfer sleeve is in the correct position, with the handles to the top and bottom. Continue pumping slowly to create the erection. If you feel any pain, stop pumping and press the release button to eliminate the vacuum. You can try again when you're ready. Pumping slowly is most beneficial. When the desired erection has been achieved, continue to hold the tube tightly against your body. Ease the constriction ring off the transfer sleeve and onto the base of your penis. Press the release button to lower the vacuum pressure and remove the penile tube. With the constriction ring in place, sexual intercourse can be accomplished. If a condom is to be worn, it should be put on as a last step. Please ensure that the lubricating jelly used with the system is compatible with your condom type. To remove the constriction ring after intercourse, simply grasp the outer handles to stretch the central ring. As the blood is released from the penis, it will decrease in size and the ring may be easily removed. Do not wear the constriction ring for more than 30 minutes at a time, and allow a minimum of 60 minutes between uses.
So we'll talk a little bit about the VED using for penile reconditioning, or what we like to call penile rehabilitation. So talking about the penile reconditioning, one of the times that we talk about this very big is after a man has a radical prostatectomy for prostate cancer. And studies have clearly shown that certainly after the prostatectomy, there is some trauma and pulling to the nerves, such that even if we were to get out a year later down the road, 6, 12 months, and if we were omniscient and knew that the man was going to have totally normal, great erections down the road, but sort of like a stroke, they were disabled, maybe think of it like bedbound and couldn't walk around, where the penis is not doing much of anything, not having morning erections, not having spontaneous nighttime erections. And we know it's been well documented that men can lose volume, length, and girth of the penis, such that when their erections are even fully functional without Viagra after a surgery like that, down the road, when the nerves have recovered and everything is back working again, they have lost size of the penis and are not as happy. And we also see this just in guys developing erectile dysfunction, that over time that start to lose morning erections, nocturnal or nighttime erections, which are really a part of the maintenance system that the body does to maintain the penis. The nighttime erections, we see that in all mammals, all animals, anyone that really reproduces to make offspring. Nature has made it so if you want to continue your species, the sexual organs need to function. And if they can't, then certainly you can't maintain your species. There's only one mammal on Earth that has kind of figured out how to handle, difficulty conceiving, and that's us. So really maintaining the function of the penis and getting the ability to get sperm to an egg to continue our species is very important. So when erectile dysfunction develops, we can think about it again like someone becoming deconditioned, weak. Maybe they broke their hip and they're laying in bed for a while. And by a while, I mean weeks to months. And again, maybe they'll get up eventually and have rehabilitation and therapy and get back running their marathons and playing tennis. But they may lose muscle mass and the muscle strength and so on. So just as physical therapy, even while someone's in bed and had a stroke or a fall or something like that is important, the penile reconditioning can be very important to men who are we're treating for erectile dysfunction. They may again discover oral medications, but we may also talk to them about using a vacuum pump, the sort of the physical therapy for the penis to try and regain some of that length and girth. We might talk about that with any of the treatments, penile injections that we use, even some of the regenerative treatments that I've been doing. One of the few urologists in the county, in the area, that's doing platelet-rich plasma injections and shockwave therapy. And a pump is an integral part of the treatment. I describe it as the treatment we do in the office is like the surgery an orthopedist does. I had my rotator cuff operated on about 15 months ago. And I can certainly tell you that if I can go to physical therapy 3 times a week for like 3 or 4 months, there's no way in hell I'd be able to do the same thing with my operated on shoulder as I can do with my good shoulder. And I kind of think about that, the same thing with penile rehab, whether it's someone who's getting treatment or even just using a pump in and of itself as the treatment for erectile dysfunction. I think we can use the pump to get the erection, but we can also use the pump to perhaps regain some length and girth. And I've definitely had patients that when their regimented and use the pump the way we kind of go through our penile rehab program here at Broward Urology Center, that they have definitely had patients regain most of, if not all, the length and girth that they've lost over time. So let's see what I've missed here in my long-winded discussion. We talked about the nocturnal erections. We talked about, I think the way I describe the pump is expanding. So there's a physical aspect of expanding the tissue and sort of muscle memory, as you will. People, I'm going to use the orthopedic example again, is people that develop contractures. So if I didn't use my shoulder enough and do the physical therapy and really take it to the limits of what it was able to do, I can start to develop contractures and not be able to raise my arm above my head or lower it all the way. The same thing with the penis. It will not expand all the way on its own because it really hasn't been brought to that point for quite a while, and it starts to sort of shrink. And the pump can really help with that. So we can certainly talk about 3 to 5 days a week. After the regenerative treatments we do here in the office, I have patients 7 days a week using the pump, maybe 10 minutes in the morning, 10 minutes in the evening. So it's not a huge amount of time. And this is not using the ring. We're not talking about for sexual intercourse. We're really just talking about sort of exercising the penis, if you will. So again, some of the guidelines, I have my own sort of instructions that I provide patients with. And, you bring, certainly you make sure you're in proper position anytime you would use the pump, and you want to get a good seal. And to get a good seal, to reiterate here, you should not have to push that pump and make a dent in your body or bruise the bone because you're pushing so hard. That is in no way should be necessary to get a seal with at the base from the pump. So we want to bring the penis erect, generally leave it there for about 60 seconds, and then release the vacuum with the button on the top there. You can leave the pump in place. You can take it off. I suggest patients listen to the radio show, listen to a podcast, watch TV, something you can do in the privacy of your bedroom and so on. And do about 3 to 5 times maybe to start. I try and get patients to get up to about 10 times twice a day, morning and night. We may just do once a day depending on where they're at and so on, if we're not doing the regenerative treatments and just using this as a part of overall treatment for the ED. So there's not a lot, but definitely can be a lot of benefit, I think, to this process. So who's the best candidate for a VED? I'd say anyone with a penis. I think that between you and your partner, between a manual and a battery pump, there should be very little reason other than not having any arms. And there certainly are people like that have disabilities. And, with a partner, the partner can run the pump. And this, like I said, we can bring this quote into the bedroom and make this a part of the whole sexual experience. This does not need to be a medical device, be thought of as the part of the whole experience sexually. Again, having an erection for some and for many does not mean that has to lead to sexual intercourse. But most men are happier with an erect penis during sexual activity than a flaccid penis. And I think that's what it's going to help us achieve. We know that we can use it for reconditioning or rehabilitation of the penis to improve length and girth and even recover some of that has been lost. And I mentioned earlier, we certainly talk about, as urologists, using this in combination with pills, with injections. And I think, some of this is what really sets us aside as urologists, as subspecialists in sexual health. Certainly in male sexual health, I also deal with some female sexual health as well. But we're certainly often called the male gynecologist. And it's something that's an everyday process from training and something we do every day. And unfortunately, I've heard, there are these clinics, there are these online services like Roman and HIMS and telehealth visits and the non-urology erection injection clinics, some places spinning a sign outside. You may see them advertising on TV. And, these are not urologists, unfortunately. And, at least in this case we're talking here, we're the penis specialists. And as I sort of joke, but seriously say to my patients, if you have cancer in your penis, if someone cut off your penis, God knows we don't like that, Lorena Bobbitt, but if, anything else were to have an injury during sexual activity, no one's going to any of those other physicians or providers, or no one's calling it telehealth. When you go to the ER, they're not calling those people. They're calling us. We're the ones that know the penis inside and out, surgically, medically. And, I've had patients have some of these regenerative treatments elsewhere. And, I've certainly had them come in and nothing works 100%, but we've definitely had, I'd say, a minimum of 80% success in our patients, and certainly when they're chosen properly. But, I've had patients tell me that they haven't had success. And I ask them, well, did you use a pump after the treatment as part of the therapy? And the answer is almost invariably no, that the doctor or the clinic they went to was not comfortable using a pump and so on. Excuse me. And I think certainly here in my practice, the pump is an integral part of our regenerative treatments and everyday management of ED. So I think we move on to our next slide. I touched on a couple of things here as some of the side effects that could occur from the pump. Where they have here blocked ejaculation, that's not really the pump, but that's the constriction ring. And for some men, the constriction ring is great. For other men, the ring has to be tight enough that it's either tight enough to hold the blood in, but then unfortunately either uncomfortable, could constrict or block ejaculation coming through the urethra, or even cause some bruising and maybe numbness. But again, we talk about not using these rings for more than 20 or 30 minutes. I think, again, that experience and trial and error and really giving these devices a chance, finding the size ring that works for you and works best on a effectiveness standpoint as well as a side effect standpoint is important. And I think, again, having a provider that is used to using these devices, like a urologist, even some of these people that kind of bill themselves as sexual medicine and sexual health that are not urologists and sort of trained for years in evaluating and treating problems with the penis, not just erectile dysfunction, they're not going to know some of the other problems and some of the issues. They may not have the services or the comfortability offering, getting, and reading a penile Doppler ultrasound to really evaluate the degree of the erectile dysfunction and the causes of it on the arterial side, the venous side, sometimes Peyronie's disease, which is plaques and often curvature to the penis. We didn't touch on that, but some men that have a combination of erectile dysfunction and Peyronie's disease, the curvature of the penis, they would like a pump, but when the penis is bent at almost the right angle in some of these men, it's not really feasible to get the whole penis in there. It's very uncomfortable to really forcibly pull the penis out, and we really need to address the Peyronie's disease first so that we can then come back around and help with the erectile function and so on. Because even if some of these guys can have a pretty good erection, they may have a lot of pain during intercourse and even with erection from the Peyronie's disease. So I think for me, the anticoagulation, blood thinners, other than, really counseling the patients to take it easy and not go crazy with how much and how hard and how fast they're pumping up the penis. I think the blood thinners are really not a contraindication in my practice, even when we use needle injections in combination with this. So I think that's enough of what I've had to say for the side effects.
And that'll bring us to our slides. So this webinar is sponsored by Owen Mumford. They're creators of the Owen Mumford Report device right there. We'd like to thank them for making this possible tonight. This will bring us to the demonstration of this device in front of you. So I'm going to go ahead and take down the slideshow, and Dr. Chenven will show us how to assemble that device in person.
What I'm going to show you is how most of these, the Mumford, that Augusta model, but I'm going to show you the Mumford vacuum erection pump, and they all come in a nice, discreet, black kind of ditty, almost toiletry bag. God knows it can double as a toiletry bag, and so on. And I've already taken it out of the packaging. Everything comes wrapped in plastic in a separate bag and so on. We're going to look at the pieces we went over originally. So we have a 6-cylinder, okay? You have one end that is clearly where the pump goes on, and therefore the other end is where the penis goes on. There's not a lot of options here. They usually make these as one-step connections. So as they showed you in that video there, lining things up, you have on each side, you have one of these little tabs. There's one on the other side there as well. Gotta line my camera up so you can sort of see. And there's gonna be the 2 slots where they go into. There's not a lot of options, and it doesn't matter whether you do it this way or this way. It's a circle, it spins around. It's gonna push straight in the tabs along here, and then you're gonna slide and twist it till it goes all the way around to give a lock where the little nub that was sticking off the white pump end has now slid over onto the cylinder into the end of it. That's also going to ensure that the rubber seal is in, this red rubber ring is in far enough to create a seal and a vacuum. And I'm just going to undo it for you. It just untwists the other way and pulls out. This rubber ring, I tell my patients, like any kind of rubber ring on sinks and stuff like that, eventually the rubber can dry out. Most of the time, these companies, if you needed it, will you can buy replacement parts for the pumps and so on. The customer service is usually very good. They also recommend putting a little bit of just Vaseline or Aquaphor kind of petroleum jelly on this, just to keep it moist and lubricated so it doesn't get dried out and then crack and fall apart. So I'm going to put the pump back on again, a little twist, and it's on. And then I'll show you how the pump works. So let's look. I'm going to put this down for a moment. Sorry, I should sit back a little. And let's look at the other pieces that come in here. So the sleeves. We have the rubbery kind of soft plastic sleeves that go on. They have a larger one than one that's tapered down. You can see a little bit there for a smaller one. And then we have the sort of cone that allows us to slip the constriction ring onto the pump. And I'm going to show you how these things go back together. We have a instructional CD. We have the instructional manual. At the back of the manual is that constriction ring sizing device again, and it'll tell you on there, but remember this is for the flaccid, not the erect penis that you're using to measure. So you're really going to slide your penis in, and that gives you a ring number, and they give you these rings. We can see here, and I'll open up the bag, from the smaller number 4, and I'm going to go for just size difference here, to the larger number 7 in my hand. And you can see the size of the ring. You're going to use your fingers to pull it out. And, you know, these are things that then we also use and recommend. They just get the constriction rings because they're able to get a good erection, but they can't maintain it. And that's really their issue. Or at least a decent enough erection. And again, we could use just the constriction ring. We could use that in combination with something like Cialis, Viagra, and so on. And in the instruction manual, it's going to go through, explain to you all the pieces I went through, and it's going to show you in some instructions of how to use and put together the device, which I'm showing you right now. The last thing that comes with it is sort of a basic KY kind of lubricant. You can buy KY, you can buy the generic brand of KY like we use in our offices and so on. But you want a water-soluble lubricant. You don't want a silicone-based lubricant like Astroglide and Wet and many of the most other lubricants that are out there, because you don't want all the gumminess and so on. The water-soluble lubricant, as it gets in the cylinder, when you take it apart and take the top off, again, I tell my patients to just run super hot water through it. Maybe use your finger to clean it out. Occasionally, you can use some soap. Probably wouldn't put it in the dishwasher, check with the company, but I wouldn't put plastic like this in the dishwasher. But the hot water should wash all the lube off. So the conical cylinder can fit onto the end, the cone, which is the loader of the ring, can fit onto the end itself if you didn't want to use any of those sleeve attachments. You have the larger sleeve attachment, and these just slide and cinch on. And I'm gonna demonstrate with the smaller, the tapered down sleeve attachment and so on. And that one just kind of pops on with a little snap, so it kind of holds it in place. This allows you something a little softer, a little more rubbery to kind of help with the seal. Again, not that it's a need to really push down hard. And I will tell some patients, if they're not getting a good enough seal with just this, they can put a little lube on the outside. So I have my little model here to demonstrate with, and so on. So the penis is going to go inside the device. And so again, I recommend standing up or laying down, as opposed to seeing where all the skin is going to wrinkle up and making it difficult. So you can see that, you know, someone maybe with a flaccid penis this size, thickness-wise, they might be okay with the bigger ring. They could be okay with no sleeve on the end, and it's whatever works for them. Again, if the skin is getting pulled, how can I show this? If the skin or the testicles kind of getting pulled inside, a better, tighter taper is going to help prevent that. And that's what's going to make it more comfortable. So once the penis is inside, and I'm trying to show this from the side here, and you get that gentle seal. This is rubbery, so it's not the normal body here. So you may see me, don't look down at it. I'm not going to push as hard. One hand's going to be here. That's really all you need. You don't need to hold the penis. One of the things that I've learned myself and from patients, I've certainly tested one of these, not this one, but one of these myself, is because I think as a man, I need to be able to really understand, in the past, long ago, I needed to understand how this device works to really be able to explain this to my patients. And sometimes the penis is certainly not in the erect state yet, but it may not be in the flaccid state. It's what we as urologists call the contracted state. And when it's in the contracted state, I kind of use the example of, if you remember when you were younger, maybe, or even now, if you're active enough and you're playing sports, let's say soccer or football, and you wear a cup as a man, and everything kind of gets squished down inside there. We like to joke around, if anyone's a Seinfeld fan, the George Costanza, I was in the pool episode, one of my favorite. And so when the penis is kind of really contracted down and small, and there's not a lot of blood is all pushed out, if you go to put the penis in there, and again, we get a little bit, the penis is going to be sort of bent over and so on, and I find is going to drag up the side. So when I tell patients that, I tell them if it's kind of in that contracted state, to just give the pump a couple of pumps, not to bring the penis fully erect, but just to bring a little bit of blood to get a little more body into the penis. So now you can maybe better reposition yourself to get the penis lined up so that it's in the middle of the pump. And remember, we talked about also putting some lube around the head of the penis so that it can glide up the pump more easily. So see how this works. So when we start pumping, I think, again, the device is made to hold in your hand like this. 2 or 3 fingers on the pump itself. See me here? We've got and kind of gripping it like a gun and so on, and the pinky down below. But the thumb is really what holds it on, and so on. So you really just need a little bit of that manual dexterity. Otherwise, you can have your partner do it with you. So we're going to get that seal on the base. And as we start pumping, it's going to take a few pumps. Again, I don't think Mr. Rubber Penis is the best one to show us. But as we do that, sorry, I did get a seal, but not the best expansion. We're going to see the penis start to expand and grow up and out of the pump. And yes, I've actually had a couple of patients that have complained to me that they were having pain with the pump at the end. And after fully understanding it, the penis was hitting the end of the pump, and they actually do have an extended cylinder that can work for a guy who's very well endowed. Again, to be able to use this device functionally and so on. So we'll see the penis expand. Now, if we're just doing the therapy part, we're going to leave it up for a minute, and then we're going to hit the release valve button at the top and release the suction. And again, I said you don't have to pull it off if you don't want, because you're only going to wait about 30, 40 seconds to do it again. So you can leave it in place and then do the same thing again with the pump, and follow the instructions that we give you on doing those. Now, if we are using the pump for sexual activity, then most likely that man is not able to maintain the erection. That means we're going to need to use one of these constriction rings. Now, it's easier to load the ring on, much easier with the pump end off, okay? Because you're going to stand the pump on a table, counter, something solid, and you're going to attach the cone onto the top, and you're going to take the ring and you're going to pull it down the cone until it snaps over the cone onto the lower part, and then the cone comes off. It's just to help load on the ring. Then we're going to put our pump back on as if we were assembling. Now, once the penis is in and the penis is brought erect, you can actually let go of the pump. If you have a good seal, the pump will literally kind of swing on the base of the body, and it's going to put enough seal, and then you're going to bring the constriction ring down, and it's going to come onto the bottom base of the penis. Now, there are multiple types of constriction rings. There are the toy kind and the vibrating kind. Certainly can be used with this. No one's saying you have to buy those, but these are more the medical kind that are tighter, that are going to have the sides to pull. Some are just a ring, and you can try looser ones or just larger versions of these rings. This is the largest one that I chose to make it easy for me to show you, but any of these rings will work. This is really it. This is the device. This is the pump. And while I kind of broke it down into a lot of steps, there's not a lot to it.
Alrighty, the first question here. Is a VED more successful than a penile implant if you have ED?
I love analogies, and I can't think of one for that, so I'm just going to explain. So I guess you can think of a VED in, again, 95% of my experience working, that it's really going to bring the penis fully erect as it can be. I think what a man was used to normally, assuming they haven't lost any length and girth over time. And then the constriction ring, as long as it maintains the blood in there. And again, sometimes there's a little bit of seepage. So, not joking around. Again, we told you that these rings, generally 20 or 30 minutes, that's about what we want to look for. That is, including foreplay, quite at the norm or even above the norm of the duration of sexual activity for your average couple. We're not talking about an hour or two marathon session where, again, the ring may let a little tiny bit at a time of blood out and the penis start to lose some of its rigidity. Now, so I think that using the vacuum pump, if it works, yes, it's mechanical. Yes, it's a process involved. It's a little different than when someone has an implant. The implant, which is where we surgically place cylinders into the channels in the penis that fill with blood, and then they run with tubing to a reservoir that has usually some saline in it, and there's a pump, usually in the scrotum is almost a small, like a third testicle. There's a pump there to allow the release of the fluid in the reservoir when the penis is more in a flaccid state, to fill those cylinders up and to the cylinders become rather hard and stiff. The difference is, of course, the skin itself, even some of the blood superficially around the penis is not going to fill as much. And relative to the way the implant was done, as good as it's fitted into the penis is as good as it's going to get. It goes up into the sort of to the head of the penis, but not fully in. So some of the complaints, even though most of the people that have an implant that need them because no other treatment works, I think the happiness rate, the functional success and happiness with an implant is quite high. But I think what I kind of tell my patients is that I think of an implant as our final end result to help achieve an erection. That if I can get you having erections with your natural native penis and getting a good hard erection, that I think you may be a little happier on the overall scale from even the normal guy with no problems all the way out to the guy who couldn't get an erection in any way, shape, or form until we put an implant in. So hopefully I think that answers the question.
I think it does as well. Alrighty, we got time for a few more here. So next question here. Can I use a VED to enlarge the territory, so to speak, before using a trimix injection to help avoid blood vessels?
Absolutely. And I think I've had more patients teach me that than me teach patients. And I sort of pass on and impart some of that knowledge that I learned from some of my patients over time of what works best for them in the whole process. So like I said, combination of ED treatments, using the pump to sort of help bring some body, and some of these men have not lost complete function of the penis, which is possible, and a pump can work in that situation, or that some of the other treatments, but they can't quite get fully a good erection or keep it, so they're using injections, they're using pills. Sometimes using the pump ahead of time will help them get a little more body rigidity into the penis and help find the channels of where to inject a little more easily. So absolutely, Heather.
Alrighty. Next question here. I notice there's a wide variety in pricing between the manual and digital or automatic VED options, but what are some of the key factors to look at when choosing a good VED?
What I tell my patients is it's really if they have the strength, the manual dexterity that they can hold the pump in that position. If they have horrible arthritis, other medical disorders, carpal tunnel, just reasons why, broken appendages, again, of course, no appendage. One hand. Some people have one arm, one hand from an accident, trauma, different things. I think that in those situations, maybe the battery might be a little easier. Just all you're literally doing is pressing the button to start the vacuum pump, which runs on like a 9-volt or AA battery. Otherwise, I tell everyone, don't spend the money if you don't want it. I know with some of these, the battery version comes with a manual, so you kind of get a backup. For a little bit extra money, you get the battery and the manual. But for most part, I tell people, if you're kind of deciding, do I need the battery or not? If your hands work and you can do what I was just doing, you should be fine with the manual pump.
Alrighty. Got time for 2 more questions. So second to last one here is, I had a prostatectomy 16 years ago. Is it too late to start with the VED now?
I don't think there's any time that's really too late to start with the VED. Again, certainly optimally, when we do radical prostatectomies here, I really encourage my patient to get the pump before they have the surgery and get comfortable using it before they start having, changes, differences, issues afterwards, and maybe you want to put it off, don't want to deal with it. They get that comfort level with it. But I think that there's no reason or any time that you couldn't start using a VED after any treatment, other than other strange issues that you would have with pain or the Peyronie's disease example that I gave.
Alrighty. I guess this will be our final question for tonight. What can cause an injury while using a VED?
I think it comes from a few different places. Probably one of the bigger ones is really when I showed you someone who's got the cylinder and they're just pushing down way too hard on the skin. Maybe they haven't trimmed or shaved. Maybe they haven't tried using the comfort seals, the other pieces, the sleeves that attach on here. Try using some lube either on the plastic or the sleeve itself, and so on. Using a little bit of lube around the head of the penis so that when it goes in, it kind of more slides up the sides, and really just overdoing it on the vacuum. Some people may have some superficial veins that, might burst. The penis itself, those channels will certainly never burst. But you could, like people pop a vein in their eye, their forehead from straining, having a bowel movement, things like that. I think they're just overdoing it. And maybe they're overdoing it because they're having some trouble getting it fully erect. And that's sometimes where we come back in and I have them bring the pump in with them. Let's go over it. How you're doing it. What, and are they not listening? Maybe they're sitting down. The skin is kind of wrinkled up there. They're not getting that great seal, or they're doing something and releasing the seal and moving, and maybe they just don't really have that manual authority they thought they did, and so on. So there's a lot of factors there that could play in.
Alrighty. I appreciate you taking the time to answer those questions. We're going to go ahead and wrap up the event. You can find more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you have a question and would like to speak to someone in person, you can call MenMD at 857-233-5837 or log into the portal to schedule an appointment with a personal health assistant. And most importantly, if you're interested in purchasing a VED or learning how much they cost, you can do this by visiting the shop page on menmd.com or by calling our office at 857-233-5837. A few of the benefits from purchasing a VED with MenMD is that we only carry FDA-cleared medical-grade VEDs. All VED orders also receive free shipping. You'll gain access to exclusive patient support services such as the personal health assistants, as well as our website resources. Our selection of VEDs that we've curated includes some of the best options that are on the market, and we continuously develop and share educational resources such as this webinar so you can get the most out of your device.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.